Hey everyone, Dr. Sorin here, founder of Idaho Pain Clinic and interventional pain management specialist. So I want to talk today about a relatively new technology that we've seen some great results with. It's called peripheral nerve stimulation, and I want to talk all about it. I want to talk about who it's right for, what some of the complications may be, and who is going to really benefit from it. So let's just jump right into it. I'm taking some PowerPoint slides from a presentation I did, but I figured I'd do it for the YouTube audience. So let's just jump right in. Empowering lives, peripheral nerve stimulation, a revolutionary approach to pain management. So just a little bit about myself. I'm Dr. Sorin Isparescu, married. Those are my 4 children there. I'm very blessed, and I'm board certified in anesthesiology and pain management. So one of the common things that I see is people work hard their whole lives. You break your back and you've got all kinds of dreams of where you're going to end up one day. You're going to sit on the beach. You're going to be able to explore the world. You're going to be able to golf, do the things you like to do. But unfortunately, the reality is when you get to that phase of your life and you've worked hard, a lot of people end up in chronic pain. So that's where we fit in. Try to help give people their lives back, give them hope again. Because when you're in chronic pain, the world can get very dark and people can lose hope, lose faith. And so that's become my life calling, to help give people their hope back and help people live life to the fullest and enjoy whatever years God gives you. I want to help people, give them a chance to regain a life with joy and independence. So what is this peripheral nerve stimulation? Well, one of the beauties of this is if there is a specific area that is a source of pain, we can really target the pain at its source. So let's just first define chronic pain. Chronic pain is pain that lasts more than 6 months. It can be triggered by all kinds of different things. It can be mechanical pain, meaning just wear and tear, just like the brakes on your car go bad after a while, the tires go bad. These are moving parts, and so they wear out. So same thing with our joints in our body. And obviously the more you use them, like if you're a professional football player or if you are a carpenter or did some sort of physical labor job, you're going to wear them out quicker. Second type of pain is neuropathic pain, and that pain can be from either a disease state or an injury where a nerve is injured. So that is called neuropath. Neuro means nerve, path means disease. So pain coming from some sort of injury or disease of the nerves. The regular kind of pain, if you will, the mechanical pain, is called nociceptive pain, and that's just the normal pain. Like if you pinch your skin, it's going to hurt a little bit. Well, that's normal. You stub your toe, that's going to hurt. So that's how the nerves are supposed to work. So that's kind of what we call the normal nociceptive pain versus the neuropathic pain. Well, this technology can work for both. So let's talk a little bit about the pain continuum. So treating chronic pain. Well, when somebody gets an injury, you're probably going to first try rest, try, some basic medications, lifestyle changes. I'm a big believer in those. Eating right, exercise, don't smoke, do all the right things. Next, physical therapy is great. I think everybody should be doing some sort of physical therapy every day, whether it's formal or informal. We should all be exercising and doing our stretches daily. And then from there, you move into the realm where we in pain management spend a lot of our energy and time doing epidural blocks, nerve ablations, nerve blocks, so all the different types of interventional therapies. Well, let's say we do all those and somebody still has a lot of pain. Well, what are some of the options left? Surgery is always an option. For instance, if a knee joint or a hip joint has gone bad, it's worn out, well, there's a great treatment that actually has a very high efficacy, which is joint replacement. So those are options. Sometimes spine surgery may become necessary. So those may all be options. But what do you do if those are not options? Well, one area we can do is what's called neurostimulation. Now, it's been around since the 60s. It's been there for a long time, and spinal cord stimulation has been around, FDA approved, since the 80s. So that's been something they've done for a long time. But more recently, we've gotten peripheral nerve stimulators, approved by. There's 2 main kinds of neurostimulation. One is spinal cord stimulation, which is the one that's been around since the 80s. So you take these leads and you place them in the epidural space, basically just behind the spinal cord. So you place them there, and they provide stimulation to the spinal cord. And like I said, it's been FDA approved since the 80s. And those devices have worked very well for numerous different conditions. But now, more recently, the FDA has approved the peripheral nerve stimulation, which is quite a different technology. And we're going to jump into that. But the idea there is that you place these similar type of leads and you place them right next to the nerve. So if this is the nerve, you would place them on perhaps on either side of the nerve or this way, and you could stimulate a very specific nerve. So this has been fantastic when somebody has a very focal, localized pain. So this can be used for like I said, anywhere where we can get a needle and put these these leads around it. So common places are foot and ankle, knee, shoulder, lower back, the buttock area with the cluneal nerves across there, or the upper extremity arms. Like I said, anywhere where you can, if we can get to the nerve and place these leads there, then we can use that. Now, one of the interesting things is on a traditional spinal cord stimulator, these are, I think these two are real stimulators. So here's just a few different brands, but this is what the stimulators look like, and they get implanted usually in the lower back. And you can see like I said, the size of these. Now with this Nalu peripheral nerve stimulator, the IPG, the implantable pulse generator, is much, much smaller. So you can see what it looks like. And then these leads, like I said, these are not actual, these are spinal cord stimulator leads, but the idea is the same. Would plug into here, and this is all that would get implanted, would be basically a wire like this, a lead connected to this IPG. So, and the way that works is now, instead of the battery, if you will, being implanted underneath the skin, the battery is actually contained in this device, which goes on top of the skin. So there's a sticker on the back here, and these are amazing stickers. They stick really well. And so you would put it on the arm, on the leg, and I'll show you some pictures here in just a second. But this is the IPG, then the battery for it becomes external. So then you would just place the battery over the IPG. And so just like your cell phones these days, they charge without having to plug a wire in through induction. Same type of technology works on these. So who's a good candidate? Well, you got to have nerve pain that's lasted more than 6 months. Again, that meets the definition of chronic pain. And I just want to reiterate, if you go to your doctor and your knee hurts a little bit, this is not what you're going to get. But these are fantastic treatments for people that have had very specific chronic pain. And I'll give you one example. Patients with chronic knee pain. Now, obviously, if it's in a joint where the orthopedic surgeon can replace, like a knee or a hip, well, that's great, get that therapy done. But sometimes there's specific cases where a patient really doesn't want to go through a knee replacement, either because of their age, whether being too young or too old, that they don't want to go through it, but they have that chronic pain. Or a second scenario where they've already had a joint replaced and now they're just left with chronic severe pain, and the surgeon may not want to operate, and so then the patient's kind of between a rock and a hard place. So those are perfect examples of people that do really well with these. So again, like I said, previous treatments did not provide sufficient relief, and the pain is localized in a specific body part. So what are some of the benefits of neurostimulation? Well, one obvious benefit is that it's drug-free. Like I said, the main risk with these is infection or some sort of nerve damage, which is exceedingly rare. But as long as you don't get one of those complications, you're good to go. And the Nalu, these IPGs are rated for 18 years. But again, there's no moving parts or anything. There's no battery in here. It's all external. So there's no reason this thing can't last for many, many years. The more traditional spinal cord stimulators, they range in how long they're kind of warranted for. But they have rechargeable batteries in them, but those may last anywhere from 5 to 10 years. So that's one of the advantages. It's a drug-free pain management approach. So once it's in, another thing I really liked that is that the patient can control it. So it really empowers the patient. These Nalu ones have an app on your phone, and I tell patients it's like an old TV. You can turn it on and off. You can turn up the volume, meaning you can increase the intensity or decrease it, and then you can change channels. And by channels, I mean they can program. These leads can have 8 different contacts on them. And so there's all different combinations that they can use, the more distal, the contacts further down, or the more proximal, the closer ones, or the middle ones, or any sort of combination thereof. And you can have high frequency, lower frequency stimulation. There's all different types of programs they can do. So that's the channel. So on, off, volume up and down, and changing the channel or changing the program. So these things are FDA approved. They're covered by most insurances. And another beautiful thing is you get to try it before. So before we decide to implant this, if we think this may be an option for you, we can actually place the needles, and through the needle we place these leads, and they'll be sticking out of the skin, and they can plug into a device like this one, which will go in a sticker on the outside of the skin. And then you get temporarily a remote like this where you can turn it on, off, and then change the various programs, as you can see on here. So you get to try it first. Lastly, it's a reversible procedure. Say it seems to work initially and you decide to go through with it, but for whatever reason you decide you don't want it anymore, then these can be removed. Or say you get this for your knee, but then you decide to have a joint replaced, well, you can have it removed. It's not a problem. So it's not permanently changing your anatomy like other procedures may do. So, like I said, the micro IPG, this thing is implanted and it gives mild electrical pulses. The beauty of this, if you compare its tiny size, especially compared to one of these, right, it's quite a bit bigger. So if you had to have one under the skin, you might choose one of these. By the way, these can also be used for spinal cord stimulators. And probably a perfect candidate would be either somebody who's really thin, who doesn't have much excess skin. Most of us have a little bit of extra fat cushion to place these in to where they're relatively comfortable. But so somebody really thin, or believe it or not, it's very rare, but some people can have allergies to these alloys, these metals that they use. And so that might also be a candidate because these are made out of a rubbery plastic-like compound. So might have, if somebody's had an allergic reaction to one of the other stimulators, they may also be a good candidate. So like I said, once you get it implanted, you have this wearable disc that goes on top of this, and they can go on the calf, on the knee, and I'll show you some pictures here in just a second. Like I mentioned, 18-year warranty on these. So here's some examples of various places that people can wear them. So for knee pain, you can either go place the needles from a superior to the superior genicular nerves. So you would then wear this device on the thigh, or you could even approach the inferior medial and you could have it on the calf. So again, this shows you what it would look like if you wore it, if we were to place it there for a knee. If somebody were to place it for a calf or ankle pain, again, you would wear it on the calf as they demonstrate here, or for a shoulder type of pain, brachial plexus type of injury, that's where you would wear it. Or for lower back, cluneal, again, you could wear it over the lower back region. So there it is. There's the adhesive clip. And you can see this is the clip that would stick to the skin. And again, the technology here is pretty incredible. If you've ever seen anybody with a colostomy bag, those are people have to wear those 24/7. So they've got pretty incredible sticky technology that makes them it's very minimal allergic reactions, and they're easy to remove and take off and replace. So again, here you see a picture of the leads with the micro implantable pulse generator. And lastly, I just want to go over just some data here. And this comes from a 3-month trial. 6-month trial that they did. And you can see that initially the pain score was 7.62 on average. The baseline at 3 months. Here they did it for shoulder, lower back, knee, and foot and ankle pain. And you can see that at 3 months, the average pain level had dropped 68%. And at 6 months, it had gone from 7.62 to 1.60, which is a 78% drop in pain. So, and 100% of the responders, in this study, 81% got greater than 50% pain relief. And there's another study here they quote where in this study they had 22 people in the active arm. 100% of them got 50% or more pain relief. And the mean pain relief was 78%. So this is a great technology for certain subset of the population. And again, like I mentioned, when you're in chronic pain, people lose hope. So this is a technology that can help get that hope back, get people out, get them active and living a full life. Leave a comment down below or contact our office if you have any questions about this. Look forward to seeing you or hearing from you. Take care.